Hi, my name is Charity Scott, and I'm here to show you how to put on and take off your gloves safely and how to control bleeding. First, I'm going to introduce myself to the patient and say my name. Hi, my name is Charity Scott. I am first aid certified. How can I help you?
I have a cut on my arm and it is bleeding.
All right, so the first thing I'm going to do is assess the arm. I'm going to make sure that the arteries are intact. I'm going to make sure there's no objects in the arm. From what I can see, it's a superficial cut, but it's still bleeding. I'm going to go wash my hands and start putting on my gloves. After I put on my gloves, I'm then going to get the patient and get some gauze. If I don't have any gauze, I would ask the patient to apply pressure to the wound until I'm able to have some. But as for right now, I do have gauze. I'm going to place the gauze over the wound and apply pressure. If the gauze is bleeding through, I'll just put another gauze on top of it. If it's not, then I proceed to the next step. As I see, there is no bleeding through. So that since it stopped, I'm going to do a spiral method bandage, which means I'm going to grab this and then I'm going to hold the bandage over it and do a spiraling motion around the patient's arm. You're going to want to go up and over it and make sure that you go above the wound and a little bit behind the wound also. Now, once I have it secure, I'm going to make sure that it's not tight when I'm wrapping it around, and I'm going to also make sure it's not too loose that it falls off and doesn't apply the adequate pressure. I'm going to tuck the bandage in. And is this too tight?
No.
All right, and just in case, I'm going to check the capillaries of the arm. If the color does not return back in 2 seconds, that means it is too tight for the patient. Now I'm going to ask the patient to rest their arm above their heart, and I'm going to call 911. After I call 911, I'm going to tell them where the bleeding is and how much blood is being lost. And I'm going to check the level of conscience of the patient every 10 minutes to make sure that the patient is still, viable and alive. And now to take off my gloves. For my gloves, I'm going to make sure I have glove-to-glove contact and skin-to-skin contact. First thing I'm going to do is pinch the glove at the bottom and remove the glove and ball it up in this hand. After I've done that, I'm going to go underneath the glove and pull it over. And once I have that done, I'm going to put in a biohazard bag or a Ziploc bag and dispose of it safely. And that is my presentation. Thank you. Bye.